everyone. My name is Leah Binder. I'm President and CEO of the Leapfrog Group, and today is another interview in our series for the Hiding in Plain Sight LinkedIn group that Leapfrog hosts. We are learning about environmental services in hospitals and how critically important they are through that site. We encourage you all to visit and comment because it is a robust opportunity for us to have conversations with some of the leading experts in environmental services and some industry leaders as well, including, I'm very happy to introduce Dr. Ardis Hoven, who I'm interviewing today. She is from Trinity Guardian, one of Leapfrog's partners. She is an infectious disease physician who is a former president of the Kentucky Medical Association, Kentucky being one of my favorite states, I must say, because I actually spent 2 years of my preschool life in Kentucky and by Fort Knox. She's former chair of the Board of Trustees and president of the American Medical Association and past chair of Council of the World Medical Association. A large portion of her career has been working with infection preventionists. She serves on the board of directors of Trinity Guardian. Trinity Guardian, as I said, is a member of Leapfrog's Partners Advisory Committee. And you can learn more about all of these issues on our site. As I said, contribute, please. So today we're going to follow up on a really interesting article, which we posted on the site, called Healthcare Leadership Whack-A-Mole, a title I absolutely love. We sometimes get too serious in our, sometimes we get too serious in titling our important research. This is important research, but it's also important for us to be conversational and really understand what we're talking about, because this is a very important issue that I think has major implications for hospitals and for us as individuals and really as patients and people running our own households, because you're going to talk about mattresses. And so I guess when we all think about it, we realize that that we should be concerned about our mattresses, but tell us why.
Well, let me start by saying we need to start using the term mattress hygiene. We talk a lot about hand hygiene in the public health and in the infection prevention world, but mattress hygiene is another element that needs to be elevated, if you will, into the dialogue. And we know that research shows that the commonly used processes in place right now to clean a mattress do not work. Patients who are now resting on these mattresses can become secondarily infected. And we know that you have more than a 5 times greater risk of getting an infection if a prior bed occupant also had an infection.
5 times?
Pardon? Actually, it's 5.83 times. 5 times. So if that previous occupant had an infection, you have a greatly increased risk of acquiring that same infection. And we learn more and more daily on the role of the environment in causing these hospital-acquired infections. So why does this happen? Why do mattresses, which we, should think of as being quite safe, why does this happen? So the hard surface disinfectants that we're currently using were not designed for cleaning soft, porous surfaces. Years ago,
can I just ask you what kind of hard surface are you talking about? Like Clorox bleach?
Yeah. So think about the old-fashioned hard vinyl covering on bed mattresses or hospital mattresses or cushions or something like that. They were hard. And the harsh disinfectants that we use were fine for that. But because doctors and patients complained about the fact that these hard surfaces on mattresses were causing bed sores, increasing sweating, they then evolved into more softer, porous coverings for mattresses. But unfortunately, the process for cleaning these things haven't changed. We're still using the harsh disinfectants that we used 40 years ago. And so, the challenge now comes as to what do you do about it and what's happening. The problem now is, although people are trying to be more attentive to cleaning these mattresses, what they're actually using is making the situation much worse. And so the disinfectants create microscopic fissures or little tears, if you will, in the mattress cover and mattress itself, which then traps soil, bodily fluids from the patient residing in the bed. It's not only bodily fluids, but it can also then absorb other liquids, blood, sputum, wound drainage, any number of things that can be occurring with that particular patient, which then penetrate these micro fissures down into the mattress and then are contained within the mattress for maybe up to months at a time.
Oh, that's an awful thought, and hence the 5.83 times.
Correct.
Yeah, you'll get an infection if somebody else had one in the bed before
you're going to get it. You have a 5 times greater risk of getting that infection. And unfortunately, patients lying in those beds tend to not be well. They're older, immunocompromised, other, diabetes, other medical problems, putting them at risk. So you can imagine the scenario. It's a perfect storm for developing hospital-acquired infections in these damaged mattresses, then leak fluids, putting these patients at risk.
And the workers are at risk too, like nurses are at risk. Anyone
very much so.
I imagine.
So they're handling all this material. And for example, there was a case in the South where hospital employees, and in fact, doctors and nurses, acquired a Clostridium difficile infection from an immunocompromised patient, because those spores are tough and they hang around a very long period of time.
Very, very hard to get rid of. So that's a terrible infection to get, by the way. I mean, it's worth mentioning that you do not want a C. diff infection.
Well, C. diff infections have a mortality rate as high as 30% in some populations, but the morbidity with it is drastic. And my mother actually had it after an operative procedure. And it was horrible for her. It's horrible for the patient's family. And it also is very difficult for the nursing staff, because they're having to tend to these patients and they're very ill, very ill.
Okay. So what should hospitals be doing? You said they're using 40-year-old disinfectants, or disinfectants that were recommended 40 years ago with the old-fashioned mattresses, but what should they be doing?
Well, right now, you need to consider, first off, many beds. Now, not only just adult patient beds, pediatric beds, NICU beds, beds in the emergency department, gurneys transporting patients all over the hospital. So you've got to increase your sensitivity around the number of elements that could be causing the problem within the facility itself. But we know that 72% of mattresses fail. Now, that's based on scientific evidence, and that's based on looking at the mattresses.
Now, so when you say fail, you mean
they're dirty.
Agents penetrate the
They've
cover.
got pus and bugs in. I know that's sort of disgusting, but they got pus and bugs in those mattresses. And so as I mentioned earlier, the polyurethane that they're now using is very soft and porous, and this degradation has caused destruction. So right now, they need to be inspecting these mattresses. They should be inspecting a mattress after every patient use, particularly if that patient has had bodily fluids of their own production, or because of blood, like several other things that I mentioned. But the problem you've got is the turnaround time trying to get a patient, let's say, discharged home, and then getting another patient in that bed is very time limited, and the throughput is a very difficult issue for many places, many hospitals, and many healthcare teams. But you're supposed to be examining these mattresses, which means also frequently unzipping them and looking inside. And some of these mattresses you can't even get into, so you have no way of knowing. And the shelf life of these mattresses can be relatively short, despite what the manufacturers may say, because of the contamination that has occurred. When such contamination occurs, that mattress must be removed from service.
Completely just discarded entirely.
Discarded. Yeah, when that you can't fix it. You can't sterilize it particularly. It just needs to be discarded.
And is
And
it
it's
common
expensive.
practice? Oh,
Pardon?
definitely expensive. Is it common practice for hospitals to inspect mattresses after each patient?
Great question. In 2019, APIC did a study and they looked at this, and only about 50% of the hospitals actually had an inspection plan in place. Now, maybe it's gotten a bit better, but at the same time, the demand for that bed has gone up. You've got patients being held in EDs and in hallways in a variety of places. So the turnaround time becomes a very significant issue. And APIC has said, you need to be aware of this. The standards for this, I know that AAMI does not have a standard in place. ECRI actually came up with a standard that a patient's mattress must be or should be examined, particularly if they've had a lot of bodily fluids. And I'm not sure how you measure that. What's enough of a lot of bodily fluid after they've been in the hospital? But a lot of these fabrics, these mattress fabrics, only have a lifespan of about 2 years.
Only 2 years.
2 years.
And when the hospital purchases these mattresses, are they aware that they're only going to last 2 years? Or is that is that 2 years because of the standard?
I think 2 years because of what we've learned from the science of what's happening to these mattresses.
So why are hospitals doing, like, why is it only 50% of hospitals that are doing these inspection routines? Or not even that, right? We don't even know if they're fully following standard. We just know that they're doing some kind of inspection.
It's called time management, trying to move patients, the throughput, trying to get this done, very difficult. And again, they have challenges because the sicker the patient, the more likely the contamination. The sicker the patient, the more time spent by the nursing staff managing that patient, and then trying to keep those mattresses and bed covers clean becomes a real problem. It's all time related.
And I know that one of the reasons that mattresses have changed over the past 40 years and become less firm, so to speak, in my language of how mattresses feel, is because of pressure ulcers, which I know is a huge problem.
Right.
And hospitals are at actual direct financial risk, shall I put it, from CMS. If they have too many pressure ulcers, they shouldn't have any pressure ulcers. These are stage 3 and 4 pressure ulcers. I happen to know them from my own family. They are excruciating. We want to avoid them at all costs. Are there ways that hospitals can have a mattress that prevents pressure ulcers without at the same time having something that is potentially a problem for causing infections?
It's complicated. So you have a soft, porous, comfortable mattress, which diminishes sweating. And, it's more comfortable for the patient. There's better airflow and that sort of thing. What has to happen then is the nursing staff has to keep the patient moving, keep them off their areas of pressure, using other tools, elevation, a variety of measures that nursing staff know to minimize pressure sores. And you're right, pressure sores can get infected. And that was the reason that the mattress makers went to soft porous mattresses, was to diminish the number of bed sores and pressure sores that were developing in hospitalized patients.
What does this mean for us as, in our own homes? I mean, you start to think about all the ways your mattress can be unsafe. Should we be inspecting our own mattresses?
Probably not a bad idea. And that reminds me, I probably need to inspect mine. But the thing about your own mattress at home, you've got skin shedding, and any bacteria that are going to be on it are going to be part of your own normal flora. You're not an immunocompromised patient sleeping in your own bed. You've got your own flora there. There's nobody else in the bed. That hospital bed is going to see 80 patients in a year's time. That's a lot of flora, bacteria, viruses, fungi that can get into the mattress. And that hospital bed also is going to get moved from room to room and from unit to unit, and that has a lifespan of its own. So, but your own mattress at home, I'm not terribly worried about. Yep, you probably ought to clean it. It gets dusty and that sort of thing. But it's not like the situation you're dealing with in the hospital setting.
Well, that's a bit of a relief because I don't inspect my mattress too often, but I certainly will have to try to do that.
Take a peek at it sometime. I will if you will.
Okay. Um, so what is your recommendation to hospitals in general?
So let me back up a little bit. Hospital acquired infections should be non-events within our criteria for how these things should be managed. And mattress hygiene really should be a high priority. And we need to measure better how we are doing this within the hospital setting. I think people are just now realizing how important this issue is and what needs to be done about it. Built into the post-hospital room management after a patient is discharged, that mattress has to be looked at. You got to take off the sheets. You're going to take those off anyhow. They're going to housekeeping. They're going to get laundered. But that mattress must be examined, and you got to do it deliberately. You've got to have a bright light, a flashlight. You can't just go, whoops, I've looked at it. It looks pretty good. But you've got to get in there. You've got to open it up, check the fabric for holes, use a bright light, check the foam on the top, the foam on the bottom cover. And the thing you've got to do is you've got to take the time, and hospital systems have got to figure out a way to streamline this process and make it happen so that their employees have the time to do the work correctly and not feel like they are under the gun all the time. Although I understand, I don't like my patients waiting in the emergency department, but yet they need to do the right thing. And that hospital mattress has got to be managed appropriately. Just think about it. Warm body in the bed, leaking warm bodily fluids, perfect environment for microbial multiplication, and a hospital-acquired infection. Hospital-acquired infections have a mortality rate as high as 50%. Mm-hmm. And this is unacceptable in this day and age in our hospitals.
Well, and even when they're, by the way, waiting in the emergency room, which is unfortunately now waiting sometimes for days, that mattress has to be inspected routinely as well, right?
Anything that patient has been reclining, resting on, has got to be examined. And it's hard, but it has to be done. And the hospital maintenance systems are going to have to do a better job of making it an opportunity for the healthcare team to inspect those mattresses.
Well, I really think it's part of a whole patient safety effort. It's the entire patient safety team should really be incorporating this issue into their daily huddle. I mean, this
Correct.
is a major issue. Yeah. Hospitals have made a lot of progress on hospital-acquired infections. So, and I think in part because now they're publicly reported, including by Leapfrog. Hospital-acquired infections are a major part of the weighting of our hospital safety grade. So we really want to see hospitals continue that progress. And this simple though not easy to solve, but simple thing could in fact be a hidden way that all their progress is undermined, literally underneath them, right?
Right. When you minimize or cut way back on hospital-acquired infections, and although they should be never events, they do happen. I mean, in the pathogens within these mattresses, Staphylococcus aureus, vancomycin-resistant enterococcus, Stenotrophomonas, Pseudomonas. Oh, by the way, Pseudomonas now we know produces an enzyme which eats plastic.
Oh, wow.
And it increases the biofilm around itself. So just think about what's happening in that bed. So,
my God.
But if you can minimize the hospital-acquired infections, you're going to free up beds ultimately. You're going to have less occupancy, going to free up the beds. And we need to prioritize mattress cleaning and maintenance. It's a no-brainer.
And you keep your workforce safe.
And keep the workforce safe.
In addition to your patients, which of course is fundamental priority.
Right, yes. And our nursing staff, they work very hard and they get burned out. And they get burned out because they scramble all day long trying to do the best job they can. And imagine for them the psychological stress of having to deal with very, very ill patients. And then a very ill patient acquires something in the hospital like an HAI that lends itself to an increased workload. And, it's got to be very demoralizing.
Oh, yeah, that would be. Well, this has been very eye-opening and a little bit disturbing, actually, but also kind of hopeful because this isn't impossible to solve. And it sounds like um, changing the way you handle mattresses in a hospital could have an enormous impact on your patients and your workforce right away, very quickly. So I want
Remember the term mattress hygiene.
mattress hygiene. Yes, mattress hygiene. Okay. Well, this has been really helpful, and I encourage everyone to take a look at your paper on the subject, which is posted on our LinkedIn page, Hiding in Plain Sight. It's called Healthcare Leadership Whack-A-Mole. So, so I want to thank my guest, Ardis Hoven, for being with us and for this very enlightening information. And hopefully some hospitals can start preventing infections because of this right away, today.
Good.
All right.
That's why we do this work.
Thank you for doing this work.
Thank you.